Hi,
How you doing?
good. You
So
can
I
see
was,
me?
yeah, we can see you and we can hear you. It's perfect.
All right. I can't see myself, but it's okay. I'm not
Um,
on the camera.
yeah, we can see you, so it's all good. I was just telling the guys that we're going to talk a little bit about how you got to, your job at the moment, which degrees you did, a little bit about you first. Then we're going to talk a bit about a couple of simple cases that you've done, or very good cases actually, not very simple.
Thank
And
you.
then and then we're going to talk a little bit more about in-depth photography, settings, everything that you need to know.
All right. But a question before I start. Am I supposed to see you? To see myself in the camera
Uh,
here?
we can see. Have you got your phone the right way around?
I can't see. All right. Just a second. So,
Guys, can you see Farah or not? Does everything look normal, guys? Let me know in the comments. I think it's okay.
it's
I
okay.
can see you and I can see you and I can see me.
All right.
Um,
Well, I can see you, but I can't see myself.
perfect,
No problem. So we can begin.
perfect.
If we have lots of dental photography questions to answer also today.
Yeah,
But you asked me to talk a little bit about my journey, the long journey of dentistry.
yeah.
Uh, yeah, actually, it was a decision that I've made like 15 years ago when I had to
Mm,
do an option to go to college. And dentistry was not
yeah,
the only option for me. It was not my first option. I was a bit confused between three different majors. One of them was dentistry. The second one
yeah,
was photography and filmmaking. And the third one was math, pure mathematics. So then, when I had to make this decision, I started to see a little bit further for the future, the future of each major. And I
mm,
thought about photography that it would be a great idea as just a hobby, not a lifetime career. And if I chose math, I would have end my life teaching in schools or best case scenario in a university. So I ended up choosing dentistry because I thought that it has the greatest future for us. And
yeah,
now, if you ask me 15 years later, I definitely do not regret this choice. It was a great option because now I'm doing the three careers together. First, I have my own clinic, my own office as a dentist. Second, I'm a teacher at the university, St. Joseph University, where I got my diploma. And
yeah,
third, I could include photography in my career. So I'm applying photography in dentistry. And I believe that this is something very important to do for any dentist. And I'm going to talk today about the importance of dental photography in our career and how it can completely change the way we work. So I started by my DDS in the St. Joseph University in Beirut.
yeah,
I graduated in 2011, and then I started directly my first master, and it was in aesthetic dentistry. And also, when
yeah,
it was time to choose a specialty, it was not also a very easy option for me because aesthetic was not only, or prosthodontics was not my only and first option. I was also confused between prosto and periodontics. So
yeah. They're
these
very
two,
closely related.
yes, I think that they are very they complete each other. They,
Sorry, guys. I think we've got a little connect.
I lost connection, maybe.
Yeah, just very briefly, you were saying about the importance between perio and pros.
Right, perio and
Maybe the guys
pros.
told you. Maybe it just cut out.
Yeah.
Let me
So
check my internet just to make sure. I hope we're back.
I'm back now, and I can hear. Yes.
Okay.
So I was saying that it's impossible for us to do or to have an excellent aesthetic outcome without perio, without touching the gum, or without adjusting the gum or working pink aesthetic. This is why I was very confused, because I wanted to do something about aesthetic, but I saw that both majors were connected. So my plan was to start with prosthodontics, and then continue and do a second major, which is perio. But my plan, I didn't do it actually exactly as I was planning, because after I finished my first master's in prosto, I started teaching at the university. And I did a second master's in research because I needed to do my PhD. So I didn't have enough time, because a second master plus teaching at university, not enough time for me. But what I always make sure to do is, in each aesthetic case, I study the case with the periodontist. We see together what we can improve in the gum, because as I just mentioned, pink and white aesthetic, they complete each other. Yeah. And we can, you can notice, or any dentist who has me on his Insta, he can notice that most of my cases, I have done a work of gum surgery, or crown lengthening, or adjusting pink aesthetic, because white aesthetic is not enough. Yeah. For sure. Yeah, and we have some cases that we can see together. Yeah, yes, for example, this one. Imagine you can see the big amount of gingiva, which we can see. It's definitely a maxillofacial surgery, but the patient refused completely to go through maxillofacial surgery, because it's very complicated. It needs a very long time, and it's very. She should pay a lot of money. It's very expensive. So what we did here, it was 3 different procedures, other than crowns and veneers. The first step was to do crown lengthening. We did crown lengthening. We cut the gum. Second, we did.
In the comment there, Farah Antar, I think your sister or cousin.
Yeah, my sister. God bless you. Thank you.
Carry on. Sorry.
I also have a lot of questions to answer because of the story that we put yesterday. Yeah. But all these are about dental photography. So in this case specifically, a simple crown lengthening was not enough. And I believe that in this case, I did an aesthetic job, yes, but it was more a pink aesthetic job, more than a white aesthetic. So the crowns and veneers were additional. They added value to my work, but the main work was done by the perio, by the surgeon. Yes, we did first crown lengthening, and then we did a lip repositioning. We cut the gum, and then we placed the lip a little bit towards the teeth, lower. And then we also did, the plastic surgeon did fillers and Botox for the lips. Fillers and Botox to the lips. And after this, I could place my veneers and my crowns. It was a combination of veneers and crowns. But what I want to say, as a prosthodontist, it's our responsibility to guide the perio, definitely. I can never send a case like this to the perio and tell him, please just do me an aesthetic job. He cannot do it exactly as I want. He needs to know the final outcome of the crowns and veneers. This is why it's our job as aesthetic dentists to take the exact measurements and to give them to the periodontist. So this is a case where we've done 3 different procedures to be able to have this beautiful outcome. Because veneers
a good example in the other case of planning procedure actually as well. I'll put this one on. So you've done this mild planning here, which was really interesting.
Yes. For example, another case where we can see that it was impossible to do just prosthesis, which means crowns or veneers, because we have many problems. I mentioned this on the photo. First, we have a gummy smile on the premolars. Second, we have an incorrect smile curve, as we can see. It's very inappropriate.
Yeah.
We have like a reversed smile curve. Plus, we have a bad occlusion, and we have a very big gap between the upper and the lower dentition, as we can see.
Yeah.
So imagine if, as a prosto, I send this case to the perio, to the surgeon, and I tell him, please do me your work. He could never do exactly what I wanted. I should explain for him that we should correct the gummy smile. At the same time, we should correct the smile curve. And in order to correct the smile curve, I need to lengthen the tooth, or the teeth, the 4 premolars. So I needed a little bit to lengthen the teeth from the gum side, and then to shorten them from the occlusal in order to adjust the smile line and the smile curve. So here it was only a crown lengthening procedure, but by doing this simple procedure, we could fix the occlusion, we could fix the gummy smile aesthetically, and we could fix also the smile curve, and plus we could minimize the gap between the upper and the lower. So this was a case that definitely could never be treated without the periodontist.
Yeah, combination
combination of pink and white aesthetics.
Yeah, and I think this is the similar case, same case, a little bit closer, right?
Yes, yes, it is the same case.
Exactly what's going on. Do you ever work with ortho as well?
Yes, definitely. The ortho treatment was the first option, or if you want, was the first step that should be done. Okay, but the patient refused completely to go through ortho treatment. She's like 37 years old. She came to me from Jordan, by the way. I think once you mentioned that I'm Jordanian.
Yeah,
right?
I got confused because I was thinking of somebody else. When I went to the post to make the post, and then I got very confused about my geography.
Yeah, because I had many Jordanian dentists who contacted me on the private and told me, where are you working in Jordan? I told them, I'm not from Jordan, guys, I'm just from Beirut. So I had to correct the post, no problem. So she came from Jordan, and she said that she did many consultations with many dentists, and all of them told her there's no solution for her case. I told her, your first solution, or your ideal solution, should start by doing the orthodontic treatment, which enough cannot be definitely doing only ortho treatment would not be enough by itself, but it should be done as a first step. She completely refused the idea, and then I told her, we are going to prepare. You have to touch your teeth, and we have to shorten them. We have to do some preparation. She said, do whatever you want, but please give me a beautiful smile, but I'm not going to do any kind of ortho treatment. So we had to do the crown lengthening and the veneers. But I should mention that definitely my first suggestion was the ortho treatment.
Yeah.
Plus, if you know, the result, it was a good result, but honestly, it was not my favorite case, because you can see very white teeth, which are very nice. But I prefer to add some transparency and some texture, but the patient wanted this. We did many adjustments, and finally she was so happy with these teeth.
Yeah, and the other case, Karen.
If you can see the next case, just to compare. We don't have the.
Oh, this one you mean?
No, for the last one. I thought I sent you the close-up photo. But anyway.
You mean the one that you posted just yesterday?
No,
I didn't get that one.
No, I mean, I just wanted to mention that I always prefer the natural work. I like to add some transparency and some texture to my cases. But sometimes the patient refuses. He wants only white teeth. And if you can switch to the, right. If you can switch to the last case, this case, It was a very simple case, although it maybe appear a little bit very hard to treat. We can see a very big gingival display, a big amount of pink shown in the smile of the patient. So here we did simply a crown lengthening. We have waited like 4 months, and then we placed 10 veneers, and that was it. But so by a simple crown lengthening and veneers, we could change the whole life of this patient. Yes. Yes, I think he's watching us now.
Is he?
He's a fan of
your teeth, man.
my thing. Yeah.
If you're watching. Before we move on to the next section, guys, if you're enjoying this, please take a screenshot, put it on your story, and tag both of us so everybody knows we're doing live and everybody can watch it back afterwards. It's very helpful for us. Thank you. Should we talk about some of the questions, or should we go through the settings for the photography first and then do the questions? What do you reckon?
No problem. We can start with the settings. Actually, I have many questions, including these questions. We have someone who asked about the aperture or settings of each photo. We have someone who asked which is better, Canon or Nikon. Somebody told me to give some tips and tricks about photography. iPhone for photography modes and tips. Which light source we are using, and how do we practically take some good photos.
Yes.
And somebody asked me if I sent you the photos to reply to all these questions. And somebody asked me if I use mirrors in my lateral shots. So before I start to talk about the settings, just want to say something about photography. It's a small story about me and about how photography changed my whole career and the way I work. It started when I used to travel to some congress and attend big conferences of international speakers. I always say it in my photography conferences. It's an impressive story, but it really changed my career. It took it to a much better place. I used to travel and attend some conferences, and I'm reading the comments now. They are talking in Arabic. Yeah, anyway. So I used to go and see a very natural and beautiful work. I was really very impressed by some speakers abroad, not in my country, by their presentations, by their natural work, and by their beautiful photography. I was only a student, actually, at that time. And then when I came back to my country and I started my career, I made sure that I want to work natural prosto. I don't want to go to the fake. 90% of, you know better than me. On Instagram, we see lots of catastrophe.
You struggled with this lady to give her the natural one.
Yeah. Although these are still very acceptable.
Yeah, this is like the most I would go to. The most fake.
Right.
I previously had somebody ask me, come into the surgery, and the teeth were okay. And she goes, I want it to look the most fake teeth you've ever seen.
Yeah, I've got one patient like that.
I was like, no.
Actually, I've done for her, this lady, very fake smile, but they suit her so much. They were very nice on her because she was all fake.
She was very... Not plastic.
Yes.
She had a lot of work done, yeah.
Yes, so that fake smile suit her. Anyway, so let's continue. When I came back and started my work, I insisted on working very natural. I had like a taboo from fake crowns and fake veneers. Yeah. So I started to do this work. I bought a camera, and each time and every time I finish a case, I used to take a photo for this case. And then I used to look in my camera and look live to the patient and see a very big difference. On the camera, it's very ugly, and clinically speaking, or in the life reality, it was very, very nice and very natural. So I knew that there was something wrong with my photography, because photography is not only to buy the camera and go take some photos. It's really to master the settings, to understand the theory, and to know practically how to take the beautiful photos.
Yeah.
So I knew that there was something wrong. So I started to do research by my own. I did like 50 hours research about dental photography. I understood all the settings, all the theory, all the theoretical part of dental photography, but it was not enough. With these hours of research, I could, as I told you, understand the settings and do the basic photography. So I could take occlusal photos, lateral photos, the direction of the camera, of the lens, everything. But I couldn't take natural photographs, or my photos were not giving the real value for my work. But I needed my work I needed my work to be appreciated, because I can see it live. It's really natural and amazing. How can I make it appear the same on the camera? So I was very lucky that one of the most famous dental photographers, I'm not sure if you know him, his name is Milos Miladinov. He's from Romania.
I've heard of him.
Yeah, he's a very famous dental photographer, dental technician also. He came to my country, to Lebanon, and he gave 3 days workshop. I attended this course, these 3 days. I was very impressed. And at that time, he could convince me to buy the whole equipment. I only had the camera with the ring flash and the macro lens, and this was not enough. He told me, I still remember, he told me, look, go and pay money for these equipment, and believe me, your work will be much more, much higher. You will have a much bigger load of patients, and then you will take your money back and you will be rich. So I did this. I took his advice. Really, I did that, and I bought the whole equipment, and I started to master photography. And 2 years later, he was following me on Facebook and on Instagram. So he asked me to join his international team called Shoot Like a Pro team. And I started to give the workshop in the Middle East of photography. I did many conferences and workshops in the Middle East, Lebanon, Bahrain, Dubai, and other countries. So this introduction was only to motivate anyone who's watching us now that really you should start using photography in your career, especially if you are doing aesthetic cases, because your work cannot be appreciated by any other mean, only photography. You need this camera, and you need to master it. You need to understand the settings. So today I'm going to talk briefly about the settings and about the equipment, if you want, if we have time. And I'm going to answer the questions for those who are interested. Okay, so someone, as I told you, asked me about the settings and how we do practically take good photographs. This is why I sent
you should we do like the equipment first, and then when everybody understands the equipment that we're using, then we do the settings?
Sure.
Like, that makes sense, you know, like in the timeline of, you know, if I haven't got a camera and I haven't got the flash and stuff,
right.
You know, about the settings. I think that makes sense that way, right? Sorry.
Right.
At the top, what we've got is retractors and contrastors.
Yes, but before the contractors and the retractors and the contrastors, we have to know that by buying the whole equipment of the photography, first we have 3 components that we should buy: the camera body, the lens, and the light source. We definitely need a light source. Now we have we have different types of cameras. Okay, if we just put this slide, because someone asked me about the iPhone photography, the modes and tips. Okay, I will answer his question by saying that we have many types of cameras, okay, that can be used in general. We have the camera phone, we have the DSLR, digital single lens reflex. We have the intraoral camera used by some dentists. We have the compact cameras, but the best one for dental photography, If we want to be professionals, yes, it's the DSLR, which is the professional camera. Okay, and why am I saying this? Answering his question, your question for the iPhone, if you look at this slide, we can see two sensors. Someone can come and tell me, look, I have an iPhone with 32 megapixels, for example. Yes. The answer is that what matters the most is the size of the sensor, and it's not the number of megapixels. For example, my professional camera has like 22 megapixels, I think, something like that, or 26 or 24.
Yeah.
And my Huawei phone is like 40 megapixels. But definitely the DSLR is much better than the mobile phone. Why? Because look at the difference between the sensors. The bigger is the sensor, the much better is the photo quality. Definitely, because more light will come and will be captured by the sensor, and more light in the photo, definitely much more details and more clarity in the photo. This is why I definitely recommend the DSLR. But if you want and if you insist to use your iPhone, there's a slide. Yes, this device was developed by my professor. His name is Luis Hardan. He's a very famous dentist, a member of Style Italiano dentistry. He invented this. He was the first one to talk about mobile dental photography. Yeah. He did like a small studio, small device called MDP. You can attach on this device any kind of phone, smartphone, Huawei, iPhone, or Samsung. Yeah. You just can adjust it, yes, and you can use it as a small studio. It's just a light source, but it can make a big difference in the quality of photos, because as I just mentioned, the more light we have in the photo, the more clarity and details we have. So this is the device to be used if anyone wants to use mobile dental photography. Okay.
Can I ask you a question about your camera? Did you buy, because there's, even within DSLR, there is a crop sensor, or there is a full frame sensor. And also now we have micro four thirds, mirrorless.
Right. Actually, I have the full frame cameras. I have, this is a part of the question. Someone asked me which one is better, Canon or Nikon. So let me just answer these two questions together. There is a big dilemma about this question, Canon or Nikon. It's the same question as which one is better, iPhone or Samsung. It's something, I think it's something subjective and it's personal. Some people prefer the Canon, others prefer the Nikon. I have both, and both are full frame. Okay, I bought the full frame camera. But definitely the crop factor cameras, the DX cameras, can be used and can be more than enough for professional photography. My first camera was Canon DX crop factor, but I used to take very good photos with it. But then I upgraded to the full frame. It's definitely better because the sensor is bigger, but the crop sensor can do the job also. Okay, so I recommend, depending on the budget, definitely I recommend the full frame. But for those who have the DX, it's also enough. It can do the job. Okay, and I can give some examples about the full frame camera for anyone who wants to buy a camera. There's a Nikon D750. It's a very excellent camera compared to its price. I have it. It's at good price, and plus it gives beautiful outcome. Okay, and for the Canon, they can buy the 5D Mark IV or the 6D Mark II. These are also full frame cameras, but more expensive than the Nikon. So this is the first. This is the first component. I just said that we have three components for the equipment, the basics.
Then we have ring flashes, another piece, and then the lens as well. I don't think I have a picture of the lens.
Yes, I will talk about the lens. I didn't send the picture of the lens, but I can show it here, or I can just mention its name. Okay. This is the ring flash. So the first component, it's the camera body. Canon or Nikon, both are good. Full frame or DX, it's okay. But it's important to be a DSLR. Okay, this is what I recommend, or any dental photographer would recommend. The second component, it's the lens. In dentistry, we are doing a macro photography. Okay, we are not doing a regular photography because we are photographing a small piece, small area, which are teeth, and we need the smallest details, the finest details. So this is why we should use a macro lens. I will recommend one lens which is perfect for dental photography. It's neither Canon nor Nikon. It's called Tokina. The Tokina, it's a very good camera, a very good lens. It exists for Nikon and for Canon. So we can buy Tokina for Canon or Tokina for Nikon. It should be macro 100 millimeters. The focal length should be 100 millimeters.
I have a Sigma 105, again, very similar. Very similar lens.
Sigma is very good also, but I'm recommending something. Listen, it's not a question of budget, but the Tokina are really much cheaper than Canon or Nikon lens, and it's even better than the Nikon and the Canon. I use it always. It gives us 100% sharpness and very, very accurate. So I would recommend it. It's like $400, maybe $400.
Similar price,
yeah, Nikon and Canon are at least $800 to $900. So why to pay more if we can pay less and have a better quality? Thank you, Dr. Osama. This is a very dear colleague who's master also in dental photography.
Awesome.
I love his work. Yes, he's a professional in dental.
Check him out afterwards.
By the way, he was my inspiration. I forgot to mention this. The first photo I saw in dental photography was a photo of his smile that he has done. He posted his photo on Facebook, and I dropped him a comment telling him amazing photography. Wow, I was really impressed, and I said I wish I can take this kind of photo. And I always tell him he was one of my inspirations when I started. Yes. So this is the second component about the macro lens, the lens. It should be macro. If you want to buy Nikon, you can buy the Nikon lens, macro lens 105 millimeters, or Canon 100 millimeters. But I recommend for you the Tokina 100 millimeters. It would be perfect.
Yeah.
Now let's move for the third and the most important component. It's the light source. This is how everything can change. This is how we can master photography.
Yeah.
Some dentists tell me that they have the ring flash. They try hard to take shots for their aesthetic cases, but they never have beautiful results.
It's very good for the posterior work, but
100%. Ring flash, it was invented originally, but by a dentist. He invented it for taking photos inside the mouth, okay, because it has a focused ring of light, a very intense and strong. It can illuminate the whole dark oral cavity that we have. We know that we have darkness because of the cheeks and the tongue. So the ring flash is perfect for posterior shots and also for occlusal shots, mirror shots. We are going to see them now. But it's not recommended for the aesthetic cases, not for these. For these, we have, I'm not sure if they can see.
Twin flash. You have twin flash.
Yeah, the twin flash.
There's a face.
What?
It's under my face, isn't it? The twin flash. Oh.
Yes, I know. It's okay. So for these photos, for this kind of photography, if you want to see the transparency, the mamelons, the texture, and the smallest details, you have to use a studio flash or twin flash. You need definitely two flash, not one.
Yeah. Not
a ring flash. No way. The ring flash will delete and cancel all the details that we have on the frontal part of our teeth. We use two flash. Yes, we have. It's covered by the face of beer. It's okay. So it's either a twin flash that we use with a bracket. I think I have the photo here. Okay.
Looks very similar to the one for the iPhone. You can. It
Yeah.
looks very similar to this one.
This one actually.
Yeah.
Can see, I think they saw it now. It's used with a bracket. This bracket is done by Milos, by the way, and it's really wonderful because it can move very far away from the face of the patient or from the mouth of the patient. It can be used as a studio flash. Or we can go to the studio flash. If we can just move to the next slide. Yes. Studio flash should be used with the soft boxes always.
Yeah.
The soft boxes, which are the white layers placed over the flash to soften the illumination.
Yeah.
So this is the third component. You should buy either twin flash or studio flash. And if you want to have shots for the posterior teeth, for the surgery, for lateral occlusion, for example, you need a studio flash. You need a ring flash. By the way, French educated, I should mention that I'm French educated. I'm not English educated. But
yeah, you're doing very well with the English today.
Yeah. All right. So these are the components. I'm going to just repeat them very quickly. The camera body, it can be Nikon or Canon, full frame or DX. You have the macro lens. Tokina is the best one, 100 millimeters. And you need to buy the ring flash. Or if you are working only aesthetics, you can buy twin flash or studio flash. This way, you will have the basics 3 components to do photography. Now we have the accessories, which are the retractors and the contraster. So somebody asked me, how do we practically take good photographs? And someone else asked about the settings. So we have now some slides. They will show each photo how to be taken and what is the best setting for it. Or I'm just talking about the F actually, because the other settings are. Yeah, but I can answer any question about any other setting, no problem.
So this is with the retractors in the mouth, and then the end, once you've gone through your editing, it will look like this.
Right. To take this kind of photos, the patient should hold 2 retractors, okay?
Like this.
Yeah, to the outside and to the front, like this, to the outside and to the front. Yes. And then
that looks silly.
Yeah, and then we should place a contraster. Okay, by placing the contraster or the black background, it would be perfect to see the transparency better and the details.
We have a question about the reflection. Sometimes, do you get any reflection back off the contraster when it does the flash?
Not really, not really. They block the light. The contraster will block the light. No problem. So we won't have any problem with them. When shooting with the flash, do you fix it in post? I do not edit my photos. No, I do not remove the reflections. If this was your question, but the contraster are used. They will block the light and they will show better the transparency.
Maybe it can be the angle at which we are pointing the camera. If the camera is in the wrong angle, then the flash will come in the wrong angle, maybe.
Yeah, something to mention, definitely the camera should be perfectly placed straight to the teeth, okay? Because if we do a wrong position of the lens or the camera, we will have very wrong proportion of the tooth. It will appear even either shorter or longer, okay? Yeah. While when we do it straight to the teeth, it will appear very in the normal proportion. So this is something very important to
be perpendicular, 90 degrees.
Yeah, perpendicular. And this is why we should always, by taking these kind of shots, we should place the patient straight. He should be sitting and not laying on his back. Because imagine if he was laying on his back, then we should be just above him. Yeah. Okay, if he's laying. So the perfect position is to be sitting straight, and then the lens would be perpendicular. Okay, and then the patient will hold the retractors to the outside and to the front, and he can bite on his posterior teeth on the contraster very slightly. We just ask him to bite slightly, not on the interiors, only on the posteriors. And then we take the shot perpendicular to the teeth. Okay, no reflection, nothing at all. It would be a perfect photo, and we'll just have to edit it, to crop it. Okay? Yeah. So no editing, only cropping or rotating. For this kind of intraoral shots, we need to put the f if we are using twin flash or studio flash. It's between 22 and 29. I think they are familiar. You told me that you once talked about the f-stop. They should be familiar about this.
We talked about what is an f-stop, not which ones to use.
Yeah. All right. So, but they know, I mean, the difference between f29 and f20. Okay. The bigger is the number.
Yeah.
The bigger is the number. The smaller is the aperture. The less light will enter to the sensor, so the darker is the photo, but we have a better depth of field, which means practically in dentistry, the premolars and molars will appear to be very sharp.
Yeah.
All right. So for this kind of photos, we need f22, f29.
Yeah. So it's the same idea when we spoke about last time. If you're taking, when I spoke with Cami, a photo in the bright daylight in midday, you want like 1.8, 1.2, something like this. In the nighttime, like in the mouth, it's darker, so we're going to open it right up. So that f is going to be higher.
All right.
So if they didn't understand, perfect. Then we have the side shot from here.
Yes, for this kind of photos, we call them close-up photography. We have a slide. I think there's both dark black and white background.
Yeah, we got that as well.
I mean, one slide, there's close-up photography. The best camera lens I just mentioned, it's Tokina 100 millimeters macro lens. No, not this one, not this slide. Just a second. I think it's.
I'll find it. I hope I saved all of them. There was these two slides.
Number 8. Do you have number 8?
I had to crop them all, so maybe I took the numbers off.
Fine. Okay. It's just to show that the close-up photography, this can be done by with either a white or a black background. This is just one slide that I put to show that, this one. So it's either white or black background. Let's start with the white background for close-up.
There we go.
No, this is a black, this is white background, but for portrait, not for close-up.
Right, okay. I think I have it here. Maybe I missed that one. Oh, is it this one?
This one. Yes, yes, this one. So for this kind of photos, we need only one flash, but unfortunately, it's hidden by your
my face again.
It's okay.
I tried to work it out how much.
I will. It's okay. I will try to demonstrate it here. If I want to take a photo for this side of the smile, okay, with a white background, I need only one source of light. It should be the soft box of the studio flash. Okay, we have the studio flash and we have the soft box, which is white always. So I put the soft box from this side, from the opposite side, and I put my camera from this side. So let's say this is my cam, my lens.
Softbox here.
And this is, and and this is the part that I want to shoot. Yeah. The light should be from the opposite side, and here on the lens I should have what we call a reflector.
Yeah.
This is this reflector will reflect the light. Okay, so the camera is here. No, it will reflect the light from the flash to the tooth. Yes, 100%.
Yeah, I got it.
Back into the tooth. So this way we can have a very soft illumination and a beautiful one like this one, and we can see the whole texture. If we put the light directly on the side that we want to shoot, it will be very overexposed. Yes, even if we try to manage the settings, but with the reflector, it would be much more beautiful. And the softbox will play as well the role of the white background.
Yeah.
Okay. It will be.
If people don't know, if you overexpose a photograph, that area becomes very, very bright, and you lose all the detail, which is why you're not going to be able to see, the ridges on the lip and things like that. So this is the other side. So in the black background.
So for the black background, we also need one source of light, but we do not need a black background. This is the trick here. There's a trick about the black background. A small information. If we need any black background for any photo, for example, for this pen, it's enough for me to have a space behind this subject, this patient, this smile, or anything.
Yeah.
And the background will be systematically black. For example, if I want to take this mug, I want to have a black background. Okay, I will have to put the camera facing this this mug, and behind the mug, I should have like 2 meters of space, empty space. Okay, and then I will have my black background. How does the reflector look like? Somebody is asking. I will show you right now.
I did have a picture of one. There's lots of different types actually.
Yeah, but I will show him one.
Dentistry.
This is it. Can you see it? Yeah, this is the reflector. We put it on the lens, and here the opposite side where we have the light. Yes, and then the light will hit the reflector. The reflector will hit the side where we want to shoot, and we'll have a good photo. Yeah. So here in the black background, with the black background, we only need the space, empty space behind the patient, and the light from the also opposite side. Okay, not from the opposite side, sorry, without the reflector, from the same side, right, 100%, and just an empty space, and we'll have this kind of photos. And the F should be between f20 and f22. Okay, depends on the light.
Then we have the background photographs, with the white background and the black background.
The portrait.
Portraits, yeah. That's where I forgot to. So the f-stop is f20 to 22 for both of those ones. For these ones here, before when we're taking the close-up shot of the teeth. The f-stop.
I didn't. I didn't hear you well.
Sorry, the f-stop for the close-up photographs that we just looked at with the reflectors. Both f20 to 22.
No. For the white, it's between 14 and 18. It's different.
It's 14 and 18 for that one. There it is on that slide. And then for black,
it's f20, 22. Yes.
Yeah.
Someone is asking how does the black background. I just mentioned that there's no black background. We only need an empty space behind your patient, and then you will have systematically automatically a black background.
Perfect. And then we go on to this one here.
For the white, a portrait with white. Okay. Someone is asking it. Yes. So for the portrait with white background, it's the same concept, but as the close-up white background. But the difference is the F and the distance between me and the patient, because I always use macro lens for any kind of shots or for any kind of photos, even for the portrait. I have the portrait lens, but I prefer to take it with the macro. So I need a longer distance. By the way, this is my sister, Dareen, who was texting us. Yeah. So we need also the white background behind us, which is the soft box. And we need a source of light. Yeah. We need like 2 meters between me and the patient, and the f should be between 9 and 11.
Perfect.
Okay.
And then the black background, I've
also same empty space behind the patient, but the f should be between 18 and 22 as well.
18 and 22 for that one. So
yeah,
portrait shot 9 and 11 for the f-stop on a white background, black background between 18 and 20.
Yes, 18 and 22.
Perfect. Just 22, just because I realized I've not cropped the photograph enough to show everybody.
Yeah, no problem.
So I've said it a couple of times so you guys can remember it. We had a couple of other shots. So we had the lateral version.
Right. Somebody asked me if I do use mirrors in my lateral shots. So I put this example. The answer is it depends on the cheek of the patient, if it's flexible or not.
Yeah.
It depends. If he has a very real elastic jaw or elastic cheek, very flexible, and he can retract it with a retractor to the max.
So do I need one here?
Yeah. I don't know. I can't see you well. But if it's very flexible, then you can just push it away with the retractor, and you can take your photo directly. Okay, your lateral occlusion. But if it's not so flexible, and this is what I always do actually, I use a mirror, yes. I prefer to use a mirror.
Mm-hmm.
I put the mirror on the side. If I want, for example, to have a photo of the left occlusion, I just put the mirror on the left side, and I put the retractor from the opposite side, from the right one. So I don't have the reflection of the cheek and the lip, on the mirror. And also, it's not very clear, but I have it here, the slide. All right, that's it. So if you can see here, is it clear?
Just like me. Yeah, we can just about see it. Like me, your ring flash is in the way sometimes, but it's fine. We can see it. We can see it.
Yeah, so you just put the mirror on the side that we want to shoot. And the retractor from the opposite side, and the lens should be also perpendicular to the mirror, and you will have this end result.
Yeah, so guys, if you didn't see that, if I want to take a picture of this lateral excursion, I'm going to put the mirror here, I'm going to pull away, I'm going to retract here, and then the photograph is going to come here, bounce off the mirror, and take this side.
Yeah. So this is the question about the mirror. There's also, I just added 2 photos about the occlusal shots. This is the way the patient should be laid down for the upper part. We need mirrors, and better to take them with ring flash. The patient will use the retractors to the. Okay, so this is the lower one.
The lower one.
He will take that. No problem. Okay, so for the upper, we take the lips outside and to the front, and we put the camera. Okay, he opened large, and we put the mirror, and the camera and the lens should be perpendicular to the mirror. Okay, and you will have this kind of shots. We definitely have sometimes some fog on the mirror. We can use what we call a demister. It will remove the fog. Yeah, it will remove the whole fog from the mirror. Or we just can spray
heat up the mirror. So I will run it under hot water, then dry it, and then put it. But obviously, if they're breathing a lot, then it slows down and it comes misty again.
Or you just can spray some air flow from the syringe. It would be enough also. Or use the demister, which is the easiest way. So this is for
the one question there. How do you not include the actual incisors? So if I'm taking the upper occlusal, how do I keep this incisors away from the actual picture, getting in the way of the reflection?
Can I just reread the question? How do you not include of the actual incisors when you do the lateral shots? He's talking about the lateral shots. Yeah, I feel they sometimes get in the way, especially in class 2 patients. He's asking about the two centrals. He wants them to be included in the lateral shot or not?
So when he's taking,
exactly?
So if I'm retracting this side, and then I'm, I've got my my mirror in here, retraction here, photograph is coming this way. How is these teeth not getting in the way of the mirror?
They don't get in the way of the mirror. Okay, let's look together to this.
Let me turn the comments off so you guys can see.
Okay, look at this. This is exactly what we have. The mirror. Okay, yeah. What we are seeing in the mirror is exactly what we are going to have in here. We are seeing the two centrals. We are seeing the laterals, even the lateral from the other side, and we can see the whole posterior block.
Yeah, I think.
So
Nikki,
what's exactly the question?
I think, Nikki, what you need to do is look down your viewfinder when you're taking the photograph, and just move yourself across until those teeth aren't in the way. That's probably the best way to do it, because if somebody is really, really class 2, you're going to have to move a bit further than a class 1 or a class 3 guy. Or
he can even move the mirror. So he can move the mirror, and he can follow with his lens.
Yeah.
Okay. I have answered your question.
I think that makes sense. Yeah, she's happy with that. I think it's... well, we have 1 minute left. That went quick.
Sorry. We talked too much, yes.
What I'll do is I'll save this one, and then I'll restart the live so we can finish off.
Yeah,
so if you rejoin, otherwise
actually, we'll be... I think we're practically done. We answered all the questions. Do we have any other slide that we didn't talk about?
I think we did most of them.
I think, we answered all the questions, even the live questions also. So that was it.
I think the thing we wanted to ask the guys who are watching, we went through a lot of the theory behind this today. We were talking, before about whether we want to do a live demonstration with somebody where we can show you exactly how to take the photo. So if you guys are interested in that, then let us know, and we maybe think about doing that in the future.
Yes, a live demonstration about the whole, all kind of photographs, if you want.
Yeah.
Even the lab laboratory photographs.
Yeah, I think that would be nice. I think should we end it today just there, because I think we went through all of our photographs. We found out a bit about you as well. And hopefully the guys learned the basics of how to take these photographs, the f-stops needed, a bit about the camera, a bit about the lens.
Yeah.
So yeah. Guys, thank you to Farah for coming on. Please make sure you're following her. And watch out for some more live streams that are coming your way.
All right. Thank you.
Thank you for joining us.
Thank you. Bye.
Okay, bye.
Bye.